Mawphlang Community Health Center in East Khartoum district was among the 3,006 sites all over the country where the COVID-19 vaccination drive was launched. On the inaugural day, 24 health workers were vaccinated, officials said. The Mawphlang CHC was one of the 10 session sites in the 9 districts of Meghalaya which had been identified for the first round of vaccination. Speaking to Meghalaya Assembly TV, Mawphlang legislator S.K. Sun urged the citizen not to listen to any Tom, Dick or Harry on rumors circulating about the vaccine.
COVID-19 pandemic has affected the people around the world. For about 1 year now, the health worker have been struggling to prevent the spread of this virus, and the medical fraternity, the scientists, were working relentlessly to develop a vaccine for giving to people to prevent this virus. And today, I'm very, very happy that the vaccine is there and is being launched at a site of 3,006 all over the country. And in the state of Meghalaya, 10 sites have been selected today, being launched, and 2 of them are in East Khartoum district, one at Negrim and the other one here at the CHC Mawphlang. I'm very, very happy to be associated with the inaugural launch of this COVID-19 vaccination here in Mawphlang. Today we are supposed to have about 100 beneficiaries to be vaccinated here in each and every site which have been selected all over the country. But in Mawphlang here, I was informed that 35 have been registered. Then they will continue till the doses which have been assigned to them is finished. And I urge the people of the state to go ahead with this vaccination. And they should not listen to any Tom, Dick and Harry that say something about the vaccine, but they should take the advice of the health department of the state of Meghalaya that the vaccine is safe for the people of the state. And with today's association with the inaugural launch of this vaccination here in Mawphlang, I wish that this exercise of giving vaccination to the people of the state would be a success. We are the representative of the people. We depend on the machineries of the government. The officials of the different machineries of the government inform us that the vaccination is safe for the people of the state, and we go by that and urge the people of the state to listen to the officials of the government machineries and not to listen to anyone else.
Dr. Ivarika Suchang was the first beneficiary of the vaccine in Mawphlang Community Health Center, said that citizens should take the vaccine so that herd immunity is reached. Dr. Suchang also added that her main aim to take the vaccine is to protect her elderly mother, who is an asthma and diabetes patient.
Vaccination means I've been waiting for this for quite some time, quite a long time in fact, because at the end of the day I know that I need to be protected because I have an elderly person. My mom is already 80 plus and she's got diabetes, asthma. Even if I'm infected, okay, I might get away with mild infection, I might not, God knows, but mostly I might get away with a mild infection, but my mother, it might have a very bad effect on her, like it's like a death sentence for an old person at her age, So I'll have to think for her. General masses, I feel, is to take the vaccination because this is not, there are 2 types of vaccines. One is the messenger RNA vaccines, like the Pfizer, where you have to store it for minus 70 degrees. And this is the Covishield, means is that AstraZeneca Oxford vaccine. The concept is different. Messenger RNA vaccine is a new concept, but it's very good. Means in future, if we get any of this pandemic, like it will be very fast to develop those vaccines. But they are new vaccines. But Covishield Oxford vaccine is based on the old principle of how they make the vaccines, old concept. So that's why I feel the efficacy is 70%, 70% I think, and then even if it will protect 70%, it will give you 70% protection, and in 30%, even if you get infected, you will get mild infection. Now I have to think because an elderly person. At home, I have to take care of my mother, who's an asthmatic patient, who's a diabetic patient, and an age factor. And my main aim is that I'll have to keep myself protected, so that if I get infected, I might get away with a mild infection. But if I pass that infection to my mother, it will be a severe one. So I cannot take that risk. See, if it is 70% effective, means it will prevent infection. If it is 30%, like even if you get infected, it will be a mild disease, a mild infection, mild disease. You will not get complications. You will not land up in the ICU, and of course that is worth taking. You don't want to land up in the ICU. You don't want to get those severe infections. So that is the thing. I feel that it is needed. With the mask that we are wearing, Nipponka mask, with the mask that we are wearing, with the vaccine we are taking, even if it is 60% efficacy, naturally we will be 100% protected automatically, because even if it is 60 or 70% effective, with the mask we are wearing, with the precautions we are taking, washing our hands, maintaining social distancing, especially the mask, we will be more protected. And now this new strain is going on in UK. So we don't know in case we get the infection over here, which means this is an emergency need. Of course, now we can control it, and slowly what I'm thinking is about herd immunity. Herd immunity means if 60 or 70% of the population gets immune, slowly the disease will wane off. If I can speak in Khasi. If the villagers, they start taking all these vaccines, especially the people who are in contact with the public, the people in the shops, the people in the, let's say, in all walks of life, especially shopkeepers or people who are outside in touch with the public, if they get the vaccine, naturally they won't spread the infection. Herd immunity might be achieved if 60% or 70% of the people are immune. It will wane off slowly. Main thing is that we have to remove this disease slowly, because we cannot die of starvation. Once people don't get, supposing we have a lockdown like before, how will the people survive? Now the immunity will come down. They won't get proper food. Immunity will come down. That will be worse. My immunity that you in the immunity, you don't get innate immunity, but you don't get active immunity and passive immunity. Cuba ke innate immunity. Kata the first arm of like it protects us from this disease. You have the vitamin D3, teladan kakos, kumno, zinc, vitamin D3, melatonin. There are so many other things, which will, like vitamin D3, bakal prevent many cases of infection. Now with the vaccine, with this vitamin D3, efficacy might improve more. It is effective. It is effective, and we should go towards herd immunity by giving vaccination, because by being infected, you will not reach herd immunity. By being vaccinated, we will reach herd immunity. People will get to work. People will get proper food. The immune system will be strong. They can ward off these infections.